Hello, I'm Dr. J. Michael Bennett. Today we're going to talk about alternative methods of treatment. The first topic today will be platelet-rich plasma and stem cell therapies. This is a very exciting time in orthopedic surgery because there's a lot of new alternatives to surgical intervention that are out in the horizon that are being extensively studied at this point. So to be upfront, straight out, platelet-rich plasma and stem cell therapies are not covered by insurance. Now, stem cell injections can be covered in certain instances regarding bone grafting or trying to incorporate healing when it comes to bones, but as far as like tendon regeneration or tendon healing, they have not been approved. However, that being said, there are some studies that are very promising regarding platelet-rich plasma. One particular study looked at the elbow. Tennis elbow is a very big problem, particularly in overhand players, particularly in tennis players and golfers. You have golfer's elbow, but what tennis elbow is a degeneration of the tendon, the common extensor tendon, or the extensor carpi radialis longus, which is part of the common extensor tendons that insert at the lateral side of the elbow, the outside of the elbow. This basically helps you give strength with wrist extension. So anybody that does a lot of wrist extension or does a lot of forced wrist extension will develop tennis elbow. It's a dull aching pain, particularly worse when you extend your elbow, you extend your fingers, or you try to lift objects with your palm facing downward. Standard treatment for lateral epicondylitis often involves a heavy physical therapy program, counterforce bracing, which is a brace, a forearm brace that you wear around the forearm. It helps unload this tendon, as well as sometimes steroid injection. Most of the time, about 90–95% of the time, that usually would take care of itself. And the majority of the time, the lateral epicondylitis will oftentimes burn out by a 6-month period of time, sometimes up to a year. Now, occasionally we do have patients that don't respond to the steroid injection, the therapy, the counterforce bracing, and just never healed during that test of time. So they remain symptomatic from 6 months to a year. They're still having problems. The problem with getting recurrent steroid injections is that it can cause discoloration of the skin. It can also cause what's called fat atrophy, where you can actually get some thinning of the skin area, and it's not necessarily great for the tendon itself. It helps with the pain, but it does not cure you or heal the tendon. For the first time with platelet-rich plasma, we're able to take your own blood and use it to help healing. What the process involves is an aspiration of a peripheral blood, and it's taken in a special machine called a centrifuge, and the blood is spun down, and the centrifuge is used to separate the blood from the plasma. And the blood from the plasma, and then you have the platelet-rich plasma concentration, which is the platelets, which you want to think of them as very immature type of cells. These immature cells have not grown up or matured yet. So the idea is to inject these immature cells in an area that's degenerative or the tendon is bad, and basically hopefully convert those degenerative tendon cells into healthy new tendon cells. The studies at this point, there is some level 1 evidence, which means that there's very, very good studies that are out there that show that injections for tennis elbow can be beneficial. It usually can require 1 to 3 injections, one injection every 1 to 2 weeks as needed, where they take the blood, spin the blood, and inject it at this site. And so far, preliminary results are encouraging, and patients have noticed significant decrease in their pain and return in their strength. However, long-term studies are not available, particularly long-term in the sense of 10 years. This is a very, very new technology, and so we have to take that into consideration. Because it's new, insurance companies will not pay for it. So you have to work with your physician and figure out how you would like to cover the actual injection. However, it is very promising, and a number of institutions are incorporating platelet-rich plasma and stem cell therapies in a majority of their studies at this point. So anticipate that in the future we'll have much more proof and many more studies that will actually show the benefits of platelet-rich plasma and stem cell therapies. So if you have any questions regarding platelet-rich plasma, or you would like a consultation regarding whether or not you would be a candidate for platelet-rich plasma, please feel free to contact my office. I'm Dr. J. Michael Bennett. Thank you.